The surgical operating microscope can be a life-changing tool for the dental practitioner. Like any other equipment, there's a steep learning curve when transitioning to a microscope from other magnification sources.
Similar to initial attempts at indirect vision with mouth mirrors, using a microscope will initially feel awkward. With constant use, however, it will become second nature. The microscope should and will become an indispensable tool for your clinical practice.
As with the adaptation of any new technology, it helps to be prepared before first sitting down with a microscope. We'll review setup of the microscope to maximize clarity and efficiency. This includes proper focusing where all magnifications are uniformly in focus with the support arms in their proper position. Setup of the microscope can and should be done without a patient in the chair. Parfocaling, or the initial process of focusing your microscope, can be done just once without much need for further adjustments during patient care. In general, one should move from coarse focus to fine focus during setup procedures. Adjustment should begin with the eyepiece. The eyepiece width should be adjusted for the provider. This number can be recorded, as it should be constant between microscopes and can be simply adjusted before use. After adjusting and setting the width, the focus knobs on each eyepiece should be adjusted one at a time. Closing one eye, focus the contralateral eye, and then change sides. Coarse focusing can be done by moving the microscope up and down. Fine focus should be adjusted last. Of course, adjustments can be done and will need to be done periodically with the patient in the chair. Camera integration into the practice of microscopic dentistry can aid communication between the provider and patient, or between providers such as referring doctors. Video integration is possible, and new technologies are constantly being introduced to the market to increase options for recording still and moving pictures. 3D video output even exists.
The use of the surgical operating microscope is often touted as the most ergonomic means for practicing dentistry, especially when detailed work is being done, like that during endodontic therapy. Patients must be positioned for optimal viewing under the microscope, and this positioning is slightly different than if one were to use loupes. In general, patients will need to be seated more posteriorly in the chair to visualize a maxillary tooth, and may need to be slightly upright when visualizing a mandibular tooth. Tilting a patient's head can be helpful to see laterally to the right or left. Though patient comfort is always desirable, it is necessary to position the patient to maximize your visibility. Pillows and cushions can certainly improve patient comfort when using microscopes. Microscopes have great potential for diagnosis at all stages of treatment. Magnification aids in identification of dental caries, fractures, and defective restorative margins. To understand the benefits of high magnification, one need only to examine pulp spaces under the microscope. Fins and isthmuses can be directly visualized with the use of the surgical operating microscope to aid in complete cleaning and shaping of the canal space. Microscopes offer significant advantages when compared with other forms of magnification. With proper setup, the ergonomic benefits alone are immense, not to mention the enhanced visibility during diagnostic examinations and procedures.
While adapting this technology may require some initial adjustment, you'll quickly find that the microscope is an indispensable aid to clinical practice.